The latest staggering figures surrounding teenage pregnancies came to at a time when the country is battling COVID-19 pandemic, with the Education Ministry revealing the number of teenage girls who have become pregnant across the country doubling for 2020 academic year. As it stands, the country has recorded about 3,627 teenage pregnancies. Teenage pregnancy has been cited as a constraint in the elimination of gender disparities in education and other aspects of one's life journey. How is the ministry addressing this challenge, and what interventions are being implemented? The Deputy Director of the HIV and AIDS Management Unit at the Ministry of Education, Arts and Culture, that is Mr. Julius Ngifikwa, now joins us to shed more light on this situation. Good morning, Mr. Ngifikwa, and welcome to GMN.
Good morning so much. Thank you for having me.
Very well. Teenage pregnancy continues to be a challenge that is facing the education sector in Namibia. Why is this a case?
I should indicate that teenage pregnancy, especially, is from last year. It gave us a very much bad, ugly face on the Namibian landscape, and to record 3,625 actually, 3,625. That number is very much big compared to previous years, because we normally record 1,200, 1,500 per year.
So it's actually doubled.
But now it doubled. But before, when you look at 1,500, one thing that it's less, but it's not less compared to the Namibian population and compared to the learner population in the country, because we are roughly always hitting like 800 or 900,000 per year. So it's really alarming, and from this, from especially last year lockdown, we experienced that big number, and it's a reflection that the Ministry of Education needs to do deeper to find out as to what is really going on.
Correct,
Of course, we have a lot of research findings. We would like to appreciate the University of Namibia. They gave us a very scientific, research that was now 2017 on the teenage pregnancy in Namibia. So there are a lot of factors that are contributing, leading to children or to girls to become pregnant in Namibia.
Let's look at the demographics, the distribution of these numbers. Where are they?
So I should indicate that majority, as you see that the population of Namibia, it's much big number is much more in the north. So you talk of the northern regions, all the way from Kunene, the four O's, the former Vamboland, the two Kavangos, and then Zambezi. And of course, commerce comes in because of the many people coming in from different parts of the country.
So we're seeing a lot of this actually being in rural areas as compared to the urban areas, apart from the commerce one, of course. What are some of the bases and the baselines and the findings, especially from the empirical report that came from the University of Namibia?
Yeah, for sure. The majority of our schools are in rural areas. And then you expect rural schools to give you more figures on this. Number one, definitely, lack of services. We are talking about providing education to the girls and the boys through life skills education. And life skills education ought to provide that understanding and then access to services. So linkages to services. So the Ministry of Health should come in here. So our clinics, our health centers ought to provide health service, sexual reproductive health services to the girls.
Friendly services.
Frankly. And then also the issue of lack of stock. We experienced last year that our health facilities do not have stock, the products to help not only the girls, even the family planning, products.
Okay.
So even if a woman, not only the young ones, even any woman who wants to have those products. So that's actually a challenge. So that's why many girls in rural areas, they fell prey. And also, the most important thing here is education. Parents, do they buy into this understanding to say if a girl happened to be sexually active, so something needs to be done to prevent pregnancy. So administering, or having access to products, family planning products, it's not really a satanic, but people are, interpreting these things from different angles.
Yeah, it needs
so
to, yeah.
making young girls be vulnerable not to have access to these products.
Okay, now let's talk about sex education in schools.
Yes.
Some are of the opinion that this should start as early as grade 5. What's your take on that?
Yeah, Tadeusz, let me tell you the platform or the layout of the education system as far as this topic is concerned. We have soft skills. We have subjects like life skills from grade 4 to grade 12. We have religious and moral education, grade 4 to actually grade 3 to grade 12. We have natural science and health education. We have life science subject in grade 8 to 9. And then we have biology. We are now talking about grade 10 to 12.
Yeah.
All these 5 subjects are complementing one another to really give that space in the classroom for a learner to be well informed about his or her body, how the body develops, and how to avoid diseases, and especially the sexual reproductive health education, which is really needed. So we are talking about HIV and STIs, how these diseases can affect the body of a person. So those subjects are actually supposed to provide that understanding in the class. So that's how we are doing it. So sexuality education starts from currently starts from grade 4 up to grade 12, age appropriately.
Yeah, correct.
As a child grows, so then you give the topic and the content fitting that age of that particular child. Yeah, that's what we have.
Okay, good. Yes. Now, everything falls on behavior change. What are some of the behavior change interventions that HAMU is implementing in there?
Those behavior change takes time. And it takes time if it is well planned and supported by the whole society. The education that we are talking about here is not only education that the teacher or the school needs to provide, but it's a continuation of what the family has started doing at home already. So we are talking about the behavior change is actually home education being supplemented by school education, and then the community at large.
Yeah.
So the interventions are there, as I said, apart from the curriculum, we have extracurricular interventions. We have school health committees, okay? And that's our language. We are saying these learners, when they are at school, to cement what they learned in the classroom, outside there should be school health activities.
Yeah.
So where boys...
So it's a continuous messaging.
Exactly. Boys and the girls separately. It can be separately. Some topics need to be talked about separately, gender-based, and some not. So just to cement and consolidate what they learned in the class. But I wanted to indicate here that we have a problem because it seems that not all teachers or all schools that are providing life skills are really providing the quality. What is important here, it's quality education, quality information, correct information to the child, for them to internalize and understand the repercussions or the consequences of irresponsible sexual behavior. So therefore, the sexual behavior really, it takes time. It depends on how teachers are teaching. It depends on how parents are engaging their children. It depends entirely the whole society, churches, traditional authority, and so on. Because all of these people are to participate and make sure that the space is created
it's safe
for
and it's conducive for behavior change too.
Exactly.
Okay, now we're almost running out of time, but let's talk about the return of these learners or mothers now to schools and the support systems which are there to support the expecting mothers.
All right. We have what we call prevention and management of learner pregnancy policy. This policy has got 2 objectives: to prevent and then to manage.
Yes.
Right? Should their pregnancy happens, Number one is to prevent it. But then, should it happen,
Yeah.
then
Especially in this case now,
yes,
you've got over.
government wants these girls to be educated still. They have the space or the chance to come back. Should we receive, when I say we, the ministry, schools, should they receive health reports from medical, also from health workers to say, no, this child or learner mother is ready to come back to the class. The child will be taken care of because social workers have to come in to find out that everything
The best
is fine.
interest determination of the child.
So then they should come in because government is interested into them being educated and one day be able to provide for their children. So that, but it's the policy is there, but it's interpreted differently.
Okay, good.
Which sometimes you find out that.
But the mothers still have the right, and
they have that
and
opportunity.
The aim is such that after delivering,
Yes.
and the child is safe,
Yes.
and they are fit to come back to school,
Exactly.
they will come back and continue.
Definitely.
Thank you so much, Mr. Ngifikwe, and continue doing the good work.
All right. Thank you so much.
Great.